In his 50s in Washington state. And since that time, countless lives have been saved. Perhaps Senator Chuck Schumer said it best when he said, sometimes heroes don't wear capes, some wear masks and scrubs. In these 46 days, we've seen some truly heroic work from those working on the front lines. But also in that month and a half since that first death, more than 27,000 Americans have passed away from the virus. Tonight, there are more than 619,000 cases here in the U.S. And in the same 46-day time period, we've all tried to adjust with varying success to this new normal. Today, researchers at Harvard said without a vaccine, we should be prepared to keep social distancing intermittently until 2022. And in these 46 days, Americans have had to make some life-changing decisions, among them grappling with elderly loved ones in assisted living and nursing homes and their well-being. Our Kaylee Hartung leads us off tonight with a closer look at nursing homes, so many of which are on the front lines of this pandemic.
These scenes strike fear in anyone with someone they love inside a nursing home. The National Guard suited up head to toe with protective gear, testing elderly residents at one Boston facility. The risk COVID-19 poses to the greatest generation clear since that first deadly outbreak in Washington state. For Deborah de Los Angeles, painfully obvious since she woke up to a voicemail on March 4th, delivering devastating news.
I couldn't believe it. I couldn't believe she was gone.
Her mother, Twyla June Morin, died that morning at Life Care Center in Kirkland, Washington.
Your mother was totally dependent on Life Care, and you feel like Life Care failed her.
Yeah, I think, I do, and not just her.
At least 40 COVID-19 deaths are now linked to this one facility. We were there as the horror began to quickly unfold.
In the U.S. for the first time, the person who died, a man from Washington state in his 50s with underlying health conditions.
The CDC is sending a team here to Washington state to help investigate a potential outbreak among the high-risk population at this nursing home.
Later that day, we've just seen another person loaded up into this ambulance to be taken to the hospital. Susan Haley, a resident at Life Care, telling us what it feels like to be inside.
Do I want to leave? Yes, absolutely yes. It's not that the people aren't nice. It's that I don't like being trapped.
Families frustrated, begging for answers, feeling helpless as they wait for test kits to show up.
We have limited resources to battle this disease, and I think somebody somewhere decided that this population of people wasn't worth wasting resources on.
The fear and anguish we saw in Kirkland has now spread nationwide.
It's confusing. I will say that it's confusing, but I don't know what happened.
In Massachusetts, at least 38 veterans at the Holyoke Soldiers' Home have died with the virus. The situation's so alarming, federal authorities are investigating. 46% of the COVID deaths in that state are residents of adult care facilities. In New York State, as of Tuesday, at least 2,722 people have died in nursing homes and adult care facilities with COVID-19. There are positive cases in more than half the state's licensed homes.
Nursing homes have been an increasing issue because that is the vulnerable population in the vulnerable place.
And in Richmond, Virginia, now the deadliest single nursing home outbreak in the country. 45 people have died at the Canterbury Rehabilitation and Healthcare Center, and officials expect more people to die there.
To see a resident pass and to have nothing that you can do to prevent that from happening other than offering comfort and palliative care is traumatic. I mean, there's nothing but trauma when that happens. Every death, we die a little bit with every death that occurs in our facility.
Nationwide, ABC News has learned that more than 3,880 nursing home residents have died with COVID-19, and that number is based on just 13 states that are tracking nursing home deaths. Just yesterday, the CDC, FEMA, and the Centers for Medicare and Medicaid Services finalized a plan for nursing homes to report COVID-19 data to the National Healthcare Safety Network. 6 weeks after her mother's death in Washington state, this news came as a shock to Deborah de Los Angeles.
They should have been talking about this in February, not April.
Deborah's now filed the first wrongful death suit in the COVID crisis against Life Care. The complaint citing an investigation by the Centers for Medicare and Medicaid Services that concluded the facility failed to report an outbreak of respiratory illness to local authorities for 17 days and gave inadequate care to their residents during the outbreak. LifeCare, the largest privately owned long-term facility chain in the United States, is facing a fine of more than $600,000 from CMS.
LifeCare's a huge corporation and they should know better. They should just know better.
I know nothing can bring your mother back, but what do you hope this lawsuit brings?
Mostly to make nursing homes to do the right thing by their residents, do the right thing by their staff, because they're just as much, they might be younger and healthier, but they're still vulnerable.
And the staff at LifeCare telling ABC affiliate Como they did their best to try to manage an unimaginable situation.
Within 4 days, we lost 48 staff. We have about 170 staff. So within 4 days, you lose that many staff. It is next to impossible. In the next about 7 days, we lost another 32 staff.
We're all humans, so I think everyone is afraid, especially in the beginning when nobody's familiar truly with what's going on.
In a statement, LifeCare tells ABC News, "Our hearts go out to this family and the loss they have suffered during this unprecedented viral outbreak. We are unable to comment on specific legal cases that are pending, but we wish this and all families peace. The loss of any of our residents at LifeCare Center of Kirkland is felt deeply by us." Staff there continuing to care for the 32 residents who remain. But this nursing home in Riverside, California, was forced to evacuate its 84 patients.
The majority of the staff failed to show up for work, and indicating that they were fearful of their safety.
The head of the American Healthcare Association warning the country about what's to come.
There has to be a sense of national urgency around this, with the country galvanizing around helping long-term care facilities in the same way that it did hospitals. This is a crisis. It has already been bad. It will be much worse if we don't surround these facilities with the help and with the support that they need.
But now across America, the new reality. Families grappling with how to stay connected with those they love while also keeping them safe.
It's painful when you can't be with the one you love.
Judy Irish has been visiting her husband Bob at this nursing home in Wisconsin, but those visits look like this.
It has to be strict so no one gets it. There is no one in the nursing home with it at this point. And I feel it has to stay that way. So I guess we have to do what we have to do, but it's not easy. It's not easy at all.
A sacrifice Judy and so many families must make.
Not easy, that is to be sure. And Kaylee Hartung joins us now. Kaylee, what a heartbreaking struggle for these families and a difficult challenge for the facilities that are trying to isolate while still remaining connected to the outside world.
That's right, Lindsay. And these facilities across the country are really locked down now. And one of the biggest challenges they're facing is the same broader challenge we're facing as a society. And that is the point of transmission is so often unclear. At LifeCare Center in Kirkland, they still don't know how the virus infiltrated its walls. I was tested positive for the virus. I don't know specifically how I contracted it. Now, I'm one of the 80% of people who were lucky enough to only experience mild symptoms with the virus. But for people in these nursing homes who already have weakened immune systems, who have underlying medical conditions, those are the people who this virus is ravaging. And they are already in these environments, Lindsay, where once that virus gets inside, it can spread like wildfire.
Right. All right. Kaylee Hartung, our thanks to you.